Thank you everyone for joining us today. If I could get the next slide, please. Thank you so much. I'm Kim Johnson. I'm the Senior Policy Director here at the National Low Income Housing Coalition. Appreciate all of you joining. This, of course, is our bi-monthly National HoUSed campaign call, where we bring you the latest research, Hill updates, and hot gossip from Washington about homelessness and housing policy. It's my pleasure to be here to welcome you today. We have a great agenda in front of us. Next slide, please. So first, I'm going to begin with a little bit of table setting around appropriations and reconciliation. Then we're going to hear from our colleagues at the National Housing Law Project on a legal memo that they recently published on the rights of emergency housing voucher recipients. We're also going to hear from the National Healthcare for the Homeless Council about some reconciliation provisions that would impact healthcare coverage for people experiencing homelessness. And finally, as always, we will close it out with some policy updates, resources, and next steps for folks. Next slide, please. Thank you. And so, like I said at the top, we wanted to talk a little bit about appropriations versus reconciliation. We've been getting this question a lot. There is a lot of confusion around what in the world is going on Capitol Hill as they kind of navigate these two parallel but separate processes around government funding and spending and taxes. So let's dive into it just a little bit to get a little bit of table setting out of the way. Next slide, please. So part of why it can be really confusing is, of course, because the legislative process is a little bit confusing and pretty opaque, and especially when you get kind of into the nitty-gritty of how some of these processes work. For a part of why this is also confusing is they use the same language around budget. So appropriations you'll often receive referred to as the annual budget process, and then reconciliation's full name is really budget reconciliation. And so often those two things get smushed together and confused. And so I'm hoping to bring a little bit more clarity as we move forward. Next slide, please. So a couple important points to keep in mind. Appropriations is that yearly process to fund the federal government every fiscal year, which you'll often see abbreviated as FY. New fiscal years begin on October 1st, so they run from October 1st to September 30th of every year. And appropriations is also going to include funding for HUD programs in what is known as the Transportation, Housing, and Urban Development, or THUD spending bill, which you'll see again referred to as the THUD or THUD spending bill. And importantly, in appropriations, new spending bills cannot be enacted with fewer than 60 yes votes in the Senate. And so appropriations is going to require bipartisan support, which means even the party that's in the minority, so in this Congress, that means Democrats, have leverage to make sure that appropriations bills pass with adequate funding for the programs that we all care about. On the other side of the ledger, we have reconciliation, and that is a special legislative procedure that is not usually used, but it is becoming more frequently used. And that's because it allows a bill to pass with just 51 yes votes in the Senate. And so it can be enacted without bipartisan support if one party controls both the House and the Senate. So again, as we have in this Congress, Republicans control both the House and the Senate, and so they can use reconciliation to pass a bill without any of that bipartisan support. However, in exchange for that kind of easier time passing the Senate, the provisions that can be included in a reconciliation bill are restricted. And so, next slide, please. Where the rubber really hits the road in reconciliation, you're not going to see funding around housing, like the HUD's important housing programs. In appropriations, you're going to see, this president's fiscal year 2026 budget request that we saw released, I think, last week, 2 weeks ago now. And that included, a provision to slash HUD funding. It included a provision that would turn rental assistance into a block grant. And it's important to keep in mind that this is just a step in the appropriations process. It is a request, not a mandate. And it includes stuff like time limits on HUD assistance. And again, that is just a proposal, not a mandate around appropriations. Currently, the House and Senate are working on drafting their FY26 bill text, and we're expecting the House text for the THUD bill to be out later this month or in early July. And again, they have that deadline of October 1st to finish their work on the new fiscal year appropriations bill. Then over on reconciliation, the House Republicans passed their version of a reconciliation package, and it is now being considered by the Senate. And that reconciliation package includes work requirements and cuts to things like Medicaid and SNAP. It's likely that the reconciliation text is going to change in the Senate and end up getting sent back to the House before text can be finalized. But Republicans are looking to finalize that bill text before the July 4th holiday. So that is a little bit of table setting on what are the two kind of parallel processes that are going on in Congress right now. Again, appropriations is that yearly process that Congress funds the federal government through, and that always is going to include funding for HUD and all of the rental assistance programs that we care about. And then reconciliation is that kind of special legislative process that isn't often used, but that can be used to enact legislation with only 51 votes in the Senate. And so it can be used to pass something without any bipartisan support. And it's tackling cuts to Medicaid and SNAP as well as other provisions. So hopefully that provides a little bit of clarity on these two very kind of easily muddled and confusing processes. With all of that kind of table setting being said, I'm going to ask for the next slide, and I think it is to introduce our first speakers for today. Deborah Thrope, who is the Deputy Director at the National Housing Law Project, and Parisa Ijadi Magsudi, from the Senior Staff Attorney also at the National Housing Law Project, to talk about a legal memo that they recently published on the rights of emergency housing voucher recipients. So Deborah, we're going to start off by turning it over to you. Thank you so much to both of you for joining.
Perfect. Thank you so much, Kim. And hello to everybody on the call. As Kim said, I'm Deborah Thrope. I'm the Deputy Director of the National Housing Law Project. We are a federal policy advocacy organization focused on the preservation of affordable housing and tenants' rights. We work very closely with the coalition and met partners around the country to advance tenants' rights. And I am going to talk about a little piece of the first thing that Kim talked about, which is appropriations in the federal budget. So we're here today to tell you a little bit about a legal memo that NHLP put together related to tenants' rights in the emergency housing voucher program. So I'm basically going to set the stage briefly and then turn it over to my colleague Parisa, who's going to go into a little bit more detail about the memo itself. I know you all on this call have talked about emergency housing vouchers before in the past, and the fact that the program is soon to run out of funding. So we're not going to go into too much detail about that today, but again, I'm going to sort of give a quick overview just to do some level setting. Many of you may remember that during the pandemic, Congress appropriated about $5 billion for the emergency housing voucher program. And it looked a lot like the Housing Choice Voucher program, but those vouchers were reserved specifically for homeless families, at-risk families, and survivors of gender-based violence. About 70,000 vouchers were initially issued. And today, we have about 59,000 vouchers left. It was an extremely successful program. Again, it was similar. Emergency housing vouchers look really similar to housing choice vouchers, but with additional flexibilities and some additional funding for housing authorities and COCs that administer them. So essentially, the housing authorities had very high success rates for these vouchers. Many families were able to take advantage of their benefits, and in turn, the program funds were spent more quickly than any of us had anticipated. And so HUD recently sent out notices to housing authorities saying, here's how much money you have left. And then housing authorities were left to figure out, okay, with that amount of funding, how much longer can we keep this program going locally? How many families are at risk with their EHVs, and sort of what is this transition potentially going to look like? So, of course, our number one priority is to continue funding for the emergency housing voucher program. So what we're doing with the coalition and other national partners is making sure that members of Congress understand during this appropriations process the importance of including funding specifically for this pot of vouchers so that families will experience no disruption whatsoever with their vouchers, right? So, however, there's a lot of uncertainty right now. So, in the face of this uncertainty, we thought it was really important to explain what happens if, in fact, the program is no longer funded and housing authorities run out of EHV program funds on a local level. And so, what we did is go through sort of legal analysis of the rights of EHV tenants. It's really important to note that we don't have much guidance from HUD yet on exactly sort of what will happen to these tenants. HUD has not sort of come out and explicitly said when housing authorities run out of funds, this is how you should handle it with tenants. But what we're doing is using examples from other contexts to do that analysis. And so HUD issues notice it's in guidance every year around insufficient funding. So what happens when a housing authority faces a budget shortfall and has insufficient funding for any of its programs? So we're using that guidance as as a guidepost here to really analyze what EHV tenants may be facing if the program itself is not funded. And, Parisa will talk a little bit too, just about what we're hearing, many of you on the call may be from housing authorities or housing providers that administer these vouchers. So we're trying to also like piece together what are some measures that local housing providers are taking in the event that this funding no longer continues on a national level. So with that, I'm going to hand it over to my colleague Parisa, who is the primary drafter of the memo, and take it away. Thanks so much.
Thank you, Deb. And we can go to the next slide. Thank you so much. So you should see in the chat box a link to the memo. That's going to be the first link you see. The second link will be a link to a toolkit about advocacy, which we'll also touch on a little bit during this presentation. Next slide, thank you. So in the absence of specific HUD guidance related to the termination of EHV households, like Deb mentioned, we are going off of the insufficient funding regulations. And this includes specifically 24 CFR 982.454. As you can see from the legal memo, we have included some legislative history, including the fact that this regulation did not exist until the mid-1990s, before which Congress had consistently funded the program to maintain and increase the number of assisted families receiving assistance through vouchers. And so in front of you on the screen is the current insufficient funding regulation text, which states that a PHA may terminate the HAP contract if it determines, in accordance with HUD requirements, and we'll touch on that on the next slide, that funding is insufficient to support continued assistance for families in the program. The same language is also in the HAP contract, Part B of the HAP contract, between the PHA and the owner, which is also on your screen. And so what are those specific HUD requirements referenced in the regulation itself? We can go to the next slide. Thank you. Here's the additional guidance from HUD that PHAs have to follow, which does provide some important hooks for advocates to consider if the PHA is terminating HAP contracts based on the insufficient funding regulation. And we do want to stress the importance of collaboration between tenant advocates, tenants, and housing authorities and affordable housing advocates during this time, which we'll get to a little bit later in the presentation. But like Deb mentioned, if PHAs are proceeding to terminate based on the insufficient funding regulation, then complying with both the administrative plan and HUD guidance is required. Item 1 on your screen explains that the PHA may terminate only having considered all of its available budget authority, finding that insufficient, carefully considered all cost-saving measures, and the impact terminations will have both on program applicants and participants, as well as based on the guidance from HUD for the insufficient funding termination basis, issuing written notice to the HUD field office and its financial analyst at the Financial Management Center prior to issuing notices of termination, with this notice including all measures taken to date to reduce or eliminate the shortfall and the number and dates of proposed termination. The legal memo does address questions about the applicability of the third bullet under number 1. So please feel free to look to the legal memo for more information. But in providing the broad overview, we've hit on the main points. When it comes to proceeding, the PHA, having met these conditions, still needs to proceed in compliance with its administrative plan. So it's incredibly important for us to look to the administrative plan. And the PHA's administrative plan must address the insufficient funding scenario. Specifically, it must provide a description of the factors the PHA will consider when determining which HAP contracts to terminate first. And the memo goes into detail about a few of the examples from PHA plans across the nation, some of them including policies that set forth terminations based on criteria or based on ranking. For example, removing households first based on gross income, with households with the highest gross income terminating first, or prioritizing the termination of HAP contracts who meet specific criteria, such as violating program requirements. And so the big takeaway is that while the regulations provide for termination of HAP contracts based on insufficient funding, and if PHAs proceed based on that regulation, the PHA should be proceeding only if these criteria are met and if it's proceeding in compliance with its administrative plan. Next slide, thank you. And so when it comes to tenant rights, one issue that we've been hearing a lot about and we've been discussing with advocates is how much notice a tenant is entitled to before assistance is terminated, again, assuming the termination is based on insufficient funding regulations. The regulations themselves do not provide a notice period. If the administrative plan provides a notice period or a default notice period, that notice period should be what's applied. But given the circumstances here, including particularly the March 2025 notice that PHAs received about the discontinuation of funds and the vulnerable population at risk, adequate notice in the amount of at least 90 days before terminating is what we discuss and stress in the memorandum, given these circumstances. When it comes to informal hearings and whether households are entitled to an informal hearing, again, if there's a termination based on the insufficient funding regulation, the HUD regulations describe when a PHA is required to provide an informal hearing. However, it's a floor, not a ceiling. So again, we encourage advocates to look to the administrative plans. And even if the administrative plan does not expressly provide for an informal hearing in this scenario, households still have basic due process rights. For example, if there's a factual dispute, a household may be entitled to an informal hearing before the termination of a HAP contract. For example, if the insufficient funding policy is based on the criteria we mentioned or the rankings that we mentioned, and the household has a good faith contention that the termination is improper because they don't fall into that category or meet that criteria, then they may, in fact, be able to, they may be entitled to an informal hearing before their HAP contract is terminated. When a HAP contract is terminated, the lease is automatically extinguished, and we have on the screen Part C of the HAP contract, provision section 12. Tenants' rights upon lease termination will depend on part on state landlord-tenant laws. And so the memo does discuss looking to state landlord-tenant laws as well as local protections, because it will become a question of state law. And we can go to the next slide. And when it comes to encouraging collaboration between tenants, advocates, PHAs, we strongly encourage in the memo the importance of meeting with PHAs to understand the transition plan for EHV households, asking the PHA to keep EHV households informed. We've seen notices already been sent out from some PHAs, and these letters should really be notifying households about the potential discontinuation of funding and explaining how the PHA will transition households from the program. Or if the PHA has not yet created a transition plan, the letter should at the very least be informing EHV households that a transition plan is in the works. When it comes to administrative plans, collaboration and working with and supporting PHAs to ensure the PHA's administrative plan includes an insufficient funding policy that prioritizes the housing stability of tenants is vital. As we mentioned before, ensuring that there's adequate notice to households prior to termination is incredibly important to increase the chance of a smooth transition and to avoid the possibility of homelessness upon exit from the program, especially given the vulnerabilities of this population. By nature of being eligible for the EHV program, they're extremely vulnerable. And so at least 90 days notice should be given before the date of termination, which is administratively reasonable given the notices we've received from HUD so far. Advocates can meet with their PHAs to discuss the financial status and cost-saving measures that have already been taken. The memo goes into depth with a few of those HUD recommended cost-saving measures, so ways to decrease program costs. And then actions to preserve tenancies. So in the memo, we've discussed a few of the ways in which different partners have worked together. So PHAs and partnerships with stakeholders to handle the potential upcoming EHV funding cliff. And those include, for example, working with state and local governments to transition families to either new or existing state or local rental funding sources. We provide some examples from New York, from the city of Pasadena. And we also mentioned the recent HUD notice that shares information about HUD providing PHAs with $1,000 per household and special fees when households are transitioned from the EHV program to the Housing Choice Voucher program. HUD has specified that it'll issue additional guidance to PHAs about how to transition families, and we are in the process of updating the memorandum. So thank you for folks that have provided us feedback already, and we're very interested in hearing what's happening on the ground and receiving feedback. So Deb, if I've missed anything, feel free to jump in. Otherwise, I think that's a conclusion of the EHV memo section.
Yeah. No, that's great. Thank you. I was just thinking we're answering the question of what happens if the program is no longer funded by Congress, right? So again, going back to my original point, our number one goal is to have Congress continue to fund the HB program. But as you all know, it's a lot of uncertainty right now. So
Definitely. Thank you both so much for that excellent overview and for your work in putting together this legal memo that's going to be so important for families who use an EHV going forward. I think if memory serves, there may be one more slide that has some additional resources. Nice, I remembered things. And so these are just a couple links to resources from the National Housing Law Project. So I'll pause there in case, Deborah Parisa, you wanted to talk a little bit about the story banking project and the memo too, which I think we linked to in the chat.
Happy to round us off. So NHLP is very interested in hearing from all of you if there are, on a range of issues, but if there's something going on with EHVs, if your housing authority put out a notice with, putting a timestamp on EHVs, and, let us know. And one way to do that is you can always contribute to our story bank, and the link is there. Any impacts really on the federal budget or, some of the policy changes happening right now, we're interested and we're collecting to aid in our advocacy. And then the memo is linked on the slide as well. And then Kim, have you launched the toolkit with this group in the past?
I can't remember because the days they just run together. But the toolkit is a piece that we've been working on with the National Housing Law Project, as well as the Center on Budget and Policy Priorities and the National Alliance to End Homelessness. It is a living document, really, that we're going to continue to update as more resources become available. But it has, background on the use of emergency housing vouchers, their origin, and the necessity of continuing to fund those important vouchers, as well as some data from our colleagues at the Center on Budget and Policy Priorities, who are doing some of the research around the states and districts that would be impacted by the loss of EHVs. And a quick question in the chat that came, or in the Q&A that came in, just asking if all public housing authorities received emergency housing vouchers when they were allocated.
I think most of them did. I don't know about all of them. I mean, and this goes to one of the other questions in the chat, which is really important, which is like, is there a way for housing authorities to absorb the costs of these EHVs if the program is no longer funded? I think whereas most housing authorities received EHVs, they've varied dramatically in the number. So some housing authorities may have only received 20 of these emergency housing vouchers. So it's a whole lot easier for that local housing authority to transfer those tenants and absorb them into their regular voucher program than, let's say, some of the larger jurisdictions where you see thousands of EHVs administered by any given PHA. So that's going to require additional funding. Most likely it will be a whole lot harder for the housing authority to absorb it. So our memo mentions some ideas that we've heard from housing authorities that they're thinking about to fund these vouchers should Congress not step in. So things like, emergency rental assistance at a state level. So trying to look for other sources of funding to fill the gaps. And that we're really interested in hearing about those creative ideas as well. So thank you.
Awesome. Thank you, Deborah. And another great question, is there any data available on the demographics of EHV recipients? I know that we've been having a little bit of trouble kind of tracking down that specific information.
So there is the EHV dashboard. It doesn't have demographic information, but I'm wondering what after this, maybe I'll put it in the chat, the link to the HoUSed EHV dashboard. It does contain a lot of really great information. It'll give you a snapshot of emergency housing voucher usage in your area. But yeah, demographics, is a more challenging question.
Yeah, and we're working on, trying to put those pieces together. The HUD, of course, and thank you, Parisa, for dropping the link to HUD's dashboard in the chat, has some additional details and information. We're also working, I believe the Urban Institute is doing a lot of work right now trying to figure out kind of that demographic question and who specifically is utilizing EHVs. And I'll see if I can track down that resource as well.
Yeah, I mean, we know they were set aside during the pandemic specifically for homeless families, at-risk families, and survivors of gender-based violence. So that will give whereas that's not a detailed demographic, obviously, it does give you a good, clear snapshot of the families who will likely be impacted if Congress doesn't fund the program.
Definitely.
Yeah. And I can just add, I think that's a really good opportunity for collaboration too. This is information that public housing authorities have in the disaggregate, no personally identifiable information. This is information that can be shared with advocates for advocacy. I think it's in everyone's best interest to stress the importance of the, vulnerability of this group of individuals who are potentially facing this funding cliff.
Definitely. Thank you, Parisa, and thank you, Deborah. I found the link to the Urban Institute study as well. Just dropped that in the chat too. So in case folks are interested in getting that additional information. All right, seeing no more questions coming in through the chat. Thank you, Deborah and Parisa, so much for joining, for all of your work on this memo, and we will have to have you back to talk more about it in the not too distant future. Hopefully some good updates on the continued advocacy around EHV funding and keeping tenants who use them safe.
Thanks, Kim. Thanks, everybody.
Thank you.
And so next, it's my pleasure to welcome Laura Brennan to the screen. I almost said stage. Laura Brennan is the Senior Policy Manager with the National Healthcare for the Homeless Council, and she is going to be talking about how some of the provisions in the reconciliation package would impact health coverage for people experiencing homelessness. So Laura, please, thank you so much for joining us.
Thanks, Kim. Hi, everyone. It's great to be here. As Kim said, my name is Laura Brennan. I'm with National Healthcare for the Homeless Council. We're a membership organization representing homeless healthcare providers and people that they serve. So healthcare for the homeless programs are federally funded health centers who serve predominantly people experiencing homelessness. We have 300 healthcare for the homeless programs in 2,500 locations across the country. That's serving about 1 million people every year through primary care, behavioral health care, and support services. You can go to the next slide, that'd be great. And you can jump one more over. So today I'll be talking about Medicaid and homelessness. As Kim mentioned, there's a lot going on right now through reconciliation. But before I start talking about that, I just want to outline the connection between health and homelessness and Medicaid and homelessness. As many of you may know, poor health is a cause of homelessness, and homelessness is a cause of poor health. So it's this cycle that we see often where many people who are experiencing homelessness either came into homelessness because of health conditions or experienced worsening health conditions while experiencing homelessness. So some health conditions that we often see are high rates of chronic and acute medical conditions, hypertension, diabetes. So we treat programs are treating a lot of that. And then those health conditions, when you're out experiencing stress, exposure to the environment, social isolation, encampment sweeps, those types of things worsen health conditions. And then when you're experiencing homelessness, it's harder to engage in care, right? It's harder to get to a doctor's appointment, to get prescriptions, to access the care that you need to get better and stay healthy. And so with our patients, we see higher rates of hospital and emergency department use, and unfortunately higher rates of mortality as well. And so health is a serious issue for people experiencing homelessness, and it really getting healthy and getting access to healthcare is really important to escaping homelessness. But Medicaid is a really important part of that. So for our population, Medicaid expansion, which happened through the Affordable Care Act 10 years ago, allowed Medicaid to become the leading health insurance program for unhoused people. So before expansion, 57% of our patients were uninsured, but now in the states that have expanded, 62% of our patients are covered through Medicaid. So this has really allowed people experiencing homelessness to access primary care, behavioral health care, specialty care, and management of chronic conditions. And so this helps them achieve that good health that allows them to go to school, seek housing, and escape homelessness, as I mentioned. Medicaid has also been really great as it allows states to tailor systems and services. So we've seen states add specialized services for unhoused people. So that's things like medical respite care and Tennessee supports and supportive housing. And some states use it to fund their street medicine programs as well. So it's been really vital, not just for individuals experiencing homelessness, but also for providers and healthcare access more broadly. We can go to the next slide, please. So Kim did a really helpful outline of reconciliation at the beginning of this call, but if anyone has jumped on since then, I'll just do a quick explainer. Reconciliation is a special process to advance fiscal legislation. And as Kim mentioned, the key here is that it doesn't need to meet the normal two-thirds threshold in the Senate. They only need a simple majority to pass a reconciliation bill, and the bill can't be filibustered. So it's much easier to pass through the Senate side. And that's what we're experiencing right now. So a few weeks ago, the House passed their reconciliation bill. You may have heard One Big Beautiful Bill Act. And so that was passed out of the House and is now in the Senate. And it includes historic cuts to Medicaid. It includes $715 billion in cuts over the next decade and will kick 14 million people off of insurance or put them at risk of losing their health insurance. So this bill will have serious consequences for people across the country and especially people experiencing homelessness. You may have heard there's a lot of rhetoric talking about addressing waste, fraud, and abuse in Medicaid and not kicking people off. And I just can't emphasize enough the stark contrast to reality that is. The provisions in this bill will kick millions of people off. And the map on this slide, which was put together by KFF, I cannot take credit for it, kind of outlines the loss in Medicaid enrollment over the next 10 years by state. So you can see the darker states there will lose a higher percentage of individuals off of Medicaid. And the states you see in green, so that's less than 8% loss, are states that have not expanded Medicaid. And so you'll see that the impact there is not as great as in those states that have expanded Medicaid. So Kim also mentioned this, but the goal, so the bill is now in the Senate, and the goal is to get the bill to the president's desk by July 4th, and that is certainly a hurdle. The Senate is taking up the bill. We haven't seen any legislative text come from them yet, but they have the House version, and they are discussing whether they'll make changes to it. If they do, it would have to go back to the House to be passed again. And so they're working on a really tight timeline, and we've heard, some conflicting things about whether they'll consider the same provisions to Medicaid cuts, if they might make changes. And so we're still waiting to see that text, which could come out at the end of this week, early next week. It's hard to say for certain, but they are talking about it. You can go to the next slide. So out of the House bill, that's where we have the actual legislative text, and we know what they're talking about in terms of cutting Medicaid. And so there are a lot of provisions in that bill. It is massive, but when we're specifically looking at Medicaid and the impact it will have on people experiencing homelessness, I pulled out a few of the provisions that we at National Healthcare for the Homeless Council are most concerned about. So one of those being, and I'm sure folks have heard a lot about this, is work reporting requirements. And so the provision in the bill requires that adults aged 19 to 64 prove they're engaged in 80 hours per month of, they call it community engagement, but it is, working, going to school, those sorts of activities to show that they can be on Medicaid. And so they'll have to prove that monthly. And I think that's a really important note here, is that every month they'll have to report those 80 hours of work. And another, I think, important note is that there's a study that shows that 50% of people experiencing homelessness are already working. And I'll get into a little bit about the barriers of that. But so that's just that work reporting requirement provision there. 80 hours per month of work for adults aged 19 to 64. And it does have an exemption for specific populations. And so it's disabled, medically frail, people incarcerated, people in drug treatment, and a few others, but you'll have to prove that exemption in order to qualify and remain eligible for coverage. Another provision that we're really worried about is address verification. So the bill says that states will be required to regularly obtain Medicaid enrollees' addresses and report it into a larger system. And so they don't say how often regularly obtain is, and they provide some methods to prove your address. They call it like data verification, but those things also all require the existence of an address. It's like updating the USPS mail delivery system, like updating your address there, having returned mail. And so all things that, again, would require an address. So we're really concerned about that provision's impact on people experiencing homelessness. The third one is citizenship verification, which states would be required to verify an individual citizenship status before requesting federal Medicaid funds. So if a patient comes in and gets services, and then the clinic wants to request Medicaid funds, they have to first prove that that individual is a citizen. And so that will be a barrier for a lot of our folks. The fourth one we're worried about is more frequent eligibility checks. Starting in December 2026, Medicaid expansion beneficiaries, this is specific for expansion population, will have to re-verify eligibility every 6 months. So every 6 months, they'll need to prove that they're eligible to be on Medicaid. Right now, it's every 12 months. So this is a huge change and will require twice yearly recertification, which would be, requires paperwork and would be a barrier for our folks. So those are the 4 main provisions we're worried about. I listed a couple other ones here, including penalties to states for non-citizen coverage. And so that's regardless of immigration status, 10% cut to reimbursements if states cover lawfully residing children or pregnant immigrants. Out-of-pocket cost sharing. So expansion enrollees earning over 100% of the federal poverty level can be subjected to co-pays up to $35. And that doesn't apply to primary care or mental health care, but they haven't defined those. It also prohibits all gender affirming care with the use of Medicaid funds. So that is adults and youth. It prohibits Medicaid funding to be used for gender affirming care. And then it slashes retroactive coverage from 90 days to 30 days. So those are some of the provisions we're worried about. And then I want to talk a little bit about why we're specifically worried about it for people experiencing homelessness. I think some of it is pretty straightforward when you think about address verification. People experiencing homelessness don't have an address to verify. Many live on the street, in cars, at shelters. So these temporary spaces lack a fixed address. And so without access to that, they could be kicked off simply because they don't have that and not because they aren't eligible for Medicaid. Similarly, with work reporting requirements, as I mentioned, most people experiencing homelessness are already working. And so it's the reporting of those work hours that is going to be really difficult for folks who have limited internet access and phone access to report those hours. And so we'll see individuals getting kicked off of Medicaid, not because they're not working, not because they're not eligible, but because they can't report their hours or they might miss a month. But anything that makes it harder for them to report that could mean that they get kicked off and lose coverage. I think the key theme in a lot of these provisions is this documentation that is required, and that'll be particularly hard for people who lack a safe space to store documents, who are experiencing encampment sweeps and get their documents thrown out and then have to replace them, which we all know is really hard to do when you're living in temporary spaces, on the streets, in cars. And so we are really concerned that a number of these provisions will kick folks off because they can't provide the proper documentation, won't receive notices because they don't have an address to get that documentation to. So that is a huge concern for us. And then we're also really concerned about the impact on providers who will have to help patients prove exemptions for work requirements, will have to help patients get IDs, provide their citizenship status. Like, it will be a huge administrative burden for our providers and will take away time that should be spent with patients. And then we'll also have a financial impact on their ability to provide services. If they lose their Medicaid funding, which is a huge percentage of revenue for a lot of our centers, will mean reduced program capacity and staffing cuts that will impact people experiencing homelessness and the ability for the larger population to get care. You can go to the next slide, please. So now I'm going to talk about the impact of the bill. We have a fact sheet that outlines some of those provisions and the impact for our community. I think maybe I'll have Barbara drop it in the chat since I see she already did. Okay, she's on top of it. But yep, so you can check that out. It talks a little bit about the provisions I just discussed and the impact. But really, what this means, and as I just said, is there's going to be a huge loss of access to healthcare for people experiencing homelessness. And that is really, again, due to those administrative and paperwork burdens and not a lack of eligibility. And so when people lose access to healthcare, what we're going to see is greater illness, disabilities, mortality. And as we see people get sicker because they can't access their healthcare, we know that they may not be healthy enough to work, to go to school, to do those things that they need to get stable and escape homelessness. If they lose healthcare coverage, know that that will impact their ability to remain employed because they're getting more sick without access to care. And all of this just has a negative impact, increases homelessness. We also anticipate that more people will experience medical debt, bankruptcy, and just greater housing instability because of the provisions in this bill. And so this is really harmful for our population. And I think one of the things that we're concerned is that we don't hear it talked about a lot, that connection between Medicaid and homelessness, and allowing Medicaid access to help folks get out of homelessness. And so we're trying to make that connection because the impact will be huge. Go to the next slide. So yeah, I think, as I just said, we're really trying to make that connection. And so my ask to all of you is to call your senators, ask them to reject cuts to Medicaid, uplift the impact it would have on people experiencing homelessness. I also really encourage folks to reject that narrative of waste, fraud, and abuse. If you hear it, I think it's just, it's not true. We're not addressing waste, fraud, and abuse. It is kicking people off of Medicaid. It is taking away life-saving health coverage and will really impact communities across the country. And so we just need to uplift this impact on unhoused people, on the providers who serve them, and really call it out that this will increase homelessness. And so the last thing is a link to our monthly newsletter, the Mobilizer, where we provide some of these updates and action alerts if you want to keep up with us. And that's it for me.
Awesome. Thank you so much, Laura. And thank you, Elena and Barbara, for all of your help dropping links in the chat. Elena, great to have you back, dropping links before I can even Google them. Thank you. Laura, thank you so much for joining and for going over how these provisions would really harm people experiencing homelessness and make it more difficult for them to continue or to obtain and maintain health care. We have a question that came in. A large group of people without health care and who are homeless will cause, will increase the spread of disease. Have any of those kind of points been made when having those conversations with lawmakers about the long-term impact and kind of broader health implications of changes like this?
Yeah, it's a great question. We brought it up, and it seems to be a new thought for a lot of them. The ones that are really pushing these cuts, they have not considered, as I mentioned, they've not considered the impact of people experiencing homelessness. They don't connect Medicaid and homelessness and health coverage as a solution to homelessness. And so when we bring it up, they're like, oh, I hadn't considered that. And they look to be contemplating it. But I think the important thing here is for us to be making that connection for them and to be pushing them on it, because I don't think it's something that they're considering or are fully aware of. And, with this administration and Republicans in Congress as well, we've heard a lot about, they want to address homelessness. Well, taking away Medicaid coverage is not going to do that. But in fact, providing Medicaid to folks will help us prevent and end homelessness. And so I think just leaning into that fact, because I don't believe that they're making that connection.
That's a great point. Thank you, Laura. One other thing too, under Medicaid now, funding can sometimes be used for health-related social needs, and that includes things like housing. How would the reconciliation package impact communities' ability to use that Medicaid funding for those health-related social needs like housing?
Yeah, so the reconciliation bill really impacts Medicaid expansion, which is where a lot of those waivers and services are coming from. And so as states lose funding, they won't be able to provide the same amount and type of services, because they'll be, what this just take a step back, what this bill does, it cuts federal funding. And so states could still provide some of these services, but they would have to use money out of their own budgets to do so. And they don't have the funds. And so instead of providing those services, they'll start to cut and slash to keep some critical services that they can afford, but they won't make those services up with their own state budgets. It's just fiscally not really possible for them. So we'll see a reduction in a lot of those services.
Yeah, that's a great point too. And relatedly, in this proposal, we see this kind of shift of cost to states for Medicaid. We're also seeing a shift in cost to states for SNAP. And of course, in the president's FY26 budget proposal, which again, appropriations proposal, which again is separate from this, but it would also cut funding for rental assistance and say, okay, states, this is now your responsibility too, to fill in that gap. And so I think it's important to really draw out that kind of broader impact of this constant shifting of states, funding away from the federal government and to states, and saying, oh, well, states will be able to make up this difference, when in fact, no, they won't. They don't have the money to. That's literally why they get federal funding. And Laura, I don't know if there's anything that you wanted to add to around kind of that state cost share provision and its potential impact too.
Yeah, I mean, I think Kim, you kind of said it, like states they don't have the funding. And so when we ask states to pick up some of that cost burden, they can't do it. And so we hear that it's the reason you'll hear some Republicans concerned about this bill is because they understand that the cost shift to their states will be great. But yeah, I think just lifting that up as well, there's some good resources out there, and I'll see if I can quickly pull them up and drop them in the chat that discuss that cost shift to states. And so that might be something helpful to lift up as you're calling your senators' offices as well.
Great. Thank you, Laura. Super important that everybody is, weighing in with their elected officials on the necessity of continuing funding for Medicaid and SNAP and voting down this bill that would have such a tremendous and terrible impact on people experiencing homelessness, low-income communities, and all of the people and the resources that we're fighting for every day. Well, seeing no other questions coming in, thank you so much again, Laura, for joining, for that overview of the work that the National Healthcare for the Homeless Council is doing around the reconciliation bill and its impact on people experiencing homelessness. All right, so that brings us to the last of our agenda, and that is just some policy updates. We have already touched on a lot of these, so I will not harp on it too much. But next slide, please, just to get folks updated on where things are. So like we said at the top of the call, the Trump administration released an FY26 appropriations request, using the term budget again too interchangeably, but there are appropriations requests that would slash HUD's funding by about 44% from the previous fiscal year and includes a 43% cut to HUD's rental assistance programs, as well as a proposal to just redesign rental assistance altogether by turning it into a state block grant. There is no easy way to say this, but there is also no way to do the math on that proposal and ensure that nobody loses the assistance that they rely on to keep a roof over their heads. And so we are going to be fighting back against this budget proposal, for as long as we need to, until we can guarantee that there is sufficient funding in any final FY26 bill. That appropriations request from the president would also cut homeless assistance grants by 13% from FY25 and consolidate the continuum of care and housing opportunity for persons with AIDS or HOPWA programs under what they label as an Expanded Emergency Solutions Grants or ESG program that would impose a 2-year time limit on receiving rental or homelessness assistance. And also that proposal would make it a lot more difficult for communities to use their homeless assistance funding for permanent supportive housing. Our colleagues at the National Alliance to End Homelessness have really wonderful analysis of the additional provisions impacting people experiencing homelessness proposed in that budget request, including stuff like substance abuse and mental health funding and all of the other programs that play a really important role in communities' ability to address the needs of people experiencing homelessness. That budget request would also cut $479 million from Native housing programs and consolidate programs under the Indian Housing Block Grant. Next slide, please. And again, just to emphasize or re-emphasize rather some of the stuff we were talking about earlier about emergency housing vouchers and the necessity of providing additional funding to either preserve those vouchers or to ensure that all EHV recipients can be folded into other voucher programs like the Housing Choice Voucher Program, essentially to ensure that nobody loses this assistance and nobody is pushed back into homelessness because Congress has failed to provide the funding required to make sure that these vouchers continue receiving funding. Next slide, please. So what are the next steps that we're looking at? The House and Senate appropriators are drafting their FY26 spending bills. The House Transportation, Housing, and Urban Development, or THUD subcommittee, is supposed to review or mark up their draft bill July 14th, with a full committee markup scheduled for July 17th. That means that we will likely see the text from the House sometime either towards the end of this month or early July. We will, of course, keep folks updated and provide an analysis once that text is available. And the Senate Appropriations Committee is still having a conversation around kind of top-line funding allocations and all of the other pieces of the logistical pieces of this bill and process. And of course, there is a deadline of October 1st of this year for Congress to finish their work on appropriations. The HUD Secretary, Scott Turner, is also testifying on the president's budget request, both earlier this morning, today, June 10th, and he will be testifying again tomorrow, June 11th, in the Senate. We will have an overview of those hearings in our weekly publication, the Memo to Members and Partners, next Monday. Next slide, please. And that's it. So this is our resource page. Again, we are going to be sending out these slides after the call, as well as a recording in, again, our weekly Memo to Members. Appreciate all of you joining. Thank you so much again to our speakers for sharing their insights and for all of their work, helping to keep people safely housed. And thank you to everyone for joining, for the work that you're doing on the ground. Deeply appreciate all of you and your partnership. And until next time, we will be back on June 24th with another national call focused this time on our disaster housing recovery work. So my colleague Noah Patton will be the MC for that call instead of me. So a lot to look forward to. Thank you everybody again for joining, and until next time, we'll talk soon.